Hi, I'm Heather Rose. I'm one of the dental internship students, and I'm going to do my interview with my mentor, Jennifer Robertson. So, my first question for you is, how did your dental career develop?
My dental career developed when actually I was in the medical field for several years. I roomed with my best friend. She actually went through dental hygiene school and loved her job, and so I thought, well, maybe I can take a little bit of a different turn, still kind of medical, still taking care of people, that sort of thing. So I decided to try it, tried to get into school, didn't make it in school this first time around. We moved away, then we came back, and said, okay, this is it. It's all or nothing. So I went into dental assisting and loved the program. And then from dental assisting, I went straight into hygiene. Loved it as well. And then went out and worked in private practice. Eventually, I did come back here, but that's how I got started, was just from having, lived with somebody who was in the dental field.
Okay, very good. And what led you to working in education?
Okay, that was definitely an unplanned thing. While I was completed the dental assisting program. I was in dental hygiene. Between my first and second year of dental hygiene school, there was some changes in staff. And so because I had went through dental assisting and went through the radiography program and the clinical part of dental assisting, they needed some help. So they asked if I would work part-time. And I worked part-time with them and decided I actually loved it. And when I was finished with hygiene school, went on and worked in private practice for about 2 years part-time, while the other part-time I continued my education to get my bachelor's degree so I could potentially come back and work here, because just that little bit of help that they needed here at the college made me realize that's really what I wanted to do and how I wanted to use my dental knowledge is actually back at the school instead of working in private practice.
Good. That's really interesting. Then, how did you incorporate the clinical experience you had into methodology in your teaching?
I am actually really thankful that I was able to go into working even though it was part-time and on a temp basis, that I did go work in private practice some before I just went full-on into getting my bachelor's and then coming straight in, just so I could have a little bit of clinical knowledge to use in class. I teach a handful of different classes, but for the most part with the hygiene students, I'm in their pre-clinic, so I'm able to talk to them some about, their instruments, positioning and those types of things, how to handle patients while they're learning that type of thing. Infection control, also just kind of using infection control improvements, I guess, during private practice versus how we practice here at the school. And then radiology, it's nice to be able to talk to them about taking x-rays on real patients versus patients that are dexters for most of the clinics. So it is nice to be able to incorporate some of that, and I feel like they take a lot of what I say because it's not just from the textbook, it's from real life. So
yeah, experiences, I do think, help students feel like you're more valid in what you're saying, exactly, or that they'll be able to use it. All right, so do you think that the learning environment in school prepares students for the real world?
I do. I think here we do feel like we prepare them quite a bit, but you never know. It's different when you do go to private practice. Different dentists expect different things. We do really stress a lot about teamwork. We stress about ethics and things like that we hope that they take out to private practice. But really, the ball is in their court when they get out there. I feel like they have all the basics and all the things that they should do, and we would be proud that they would continue to do those things. But when you go out to private practice, you do have to probably step it up some and please that dentist, and have good work ethics with your and patience and all your skills and things like that, for a second.
Well, and I know that on the discussion board we did the other night, I spoke with some other people that were interning, and they were saying, because I know you work with the dental assistants a lot too, that some of their programs are shorter, like 9 months. I mean, obviously ours is more of a 12-month program, which I think is good.
August.
Is there any other way that you think it could be improved? You know, anything that you would change about it if you could?
Not that I can think of anything that I would change. I really think we have a solid program here. I really think we do prepare our students as much as we can for the real world. So, you know, especially as much as we, in this program, we're able to take them out to the base for the spring semesters. We're able to put them in private practice and let them work their summer semester that way too. I just feel like we do as much as we can to prepare them.
Yeah.
But they just never know what you're going to get handed when they go to different, you know, private practices on their own.
Right. Now, what do you enjoy most and least about your job?
Oh, there's really not a whole lot I can complain about. I really enjoy so much about the program. I enjoy the people I work with. I enjoy, I'm really proud of the program, how it's set up and how we do prepare our students, our expectations of the students. I just think it's great teamwork. There's not a whole lot that I do not like. I even enjoy the extra work we have to put in preparing for lectures. There's just not really a whole lot I can say I don't like. The things that maybe I do not enjoy as much is more on the admin side. That's the only thing. Other than class preparation, lectures, the way our program itself runs, I can't complain. Nothing I can really complain about. Like I said, it's just administrative paperwork stuff that I don't really care for.
Well, that's good. Very good to hear. And if you could give me one piece of advice, what would it be?
For you, because you're taking this path, is just definitely, I mean, you're doing all the right things. I think you're in a great program, the same program I went through. I think that's exceptional as well. You are trying to work in everything you can, you know, coming here and teaching, even, you know, doing guest lecturing, things like that. Looking into other possibilities to get more teaching experience. I just think you're on the right track. You're really doing everything you can. There's really not a whole lot that I feel like I can give you advice about, you know. I just feel like you're on the ball with all that.
Well, thank you. And I really do appreciate, you know, the time you've spent helping me in radiology and just all the staff here, as far as whether I'm here working part-time or in this internship. I do feel like what you said, you know, I did graduate from here too, you know, through hygiene, but I agree that we do have a very good program, and, you know, which is a lot to be
I know,
thankful
and
for.
you're appreciated as well. You know, even though you're interning, your help, just having that extra person, you know, also the students seeing you coming through a previous graduate from here and trying to, you know, be a part of this program again and all this stuff that you're doing. I think that's, you know, they can really look up to that as well. So I do, thank you.